Hello, good evening, everyone. Happy Sunday. Apologies for the few minutes delay and for bringing the live stream backward by 30 minutes. Okay. I just felt there was no need delay until 6:30 since we are all available and it's a weekend. All right. So if you can hear me, just tell me you can hear me on um, on the chat so that I can have that understanding. Please, thank you. If you can hear me, just say you can hear me. Thank you. All right, thank you very much, Gift Idiage. You can hear me. And all right, we're going to get started. We're going to just do like two case studies because it's weekend. We just keep it short. I taught the both classes antifungal medications and there's some other classes, but we'll just do case studies on antifungal only. All right, so the case study before us here is of one Mr. Daniel, a 40-year-old man who presents with itchy, scaly patches on his chest and back for 2 weeks. He has chronic illness. He has no chronic illness, rather. Skin scraping confirms tinea vesicolor. So tinea vesicolor is a skin infection for that is caused by fungi. So let me ask the class here: is tinea vesicolor is this a superficial antifungal infection or a systemic? Sorry, is this a superficial infection or a systemic infection? From this case study here, is it superficial or systemic? If you can answer, please state it in the comment section. Okay, thank you very much, Gift. Superficial it is, and the reason why it is superficial is because it is on the skin. Okay, all right. Surface is superficial. Okay, so it means that one of the things that this doctor is doing, doctor prescribes ketoconazole tablets 200 milligram daily for 10 days. Now, the reason why there's a problem here already, there is no topical agent. So one of the things that you will likely want to do in this case, if I ask you for a nursing consultation, is to apply a topical medication for this person. All right, I told you that there is a ketoconazole shampoo and there's a 2% ketoconazole cream. Okay, so that is that for that. So the first question that is here is what class of antifungal drug? What class of antifungal drug is ketoconazole? All right, I told us that antifungal drug basically are azoles. I told us generally that antifungal drugs are azoles, okay? And examples of azoles we have fluconazole, we have miconazole, and we have several other drugs mentioned in that class. Okay. So the next question is what is the mechanism of action of ketoconazole? Ketoconazole is one of the drugs. Ketoconazole is one of the drugs that actually prevents the enzyme. I remember giving us the enzyme in class that inhibits um, the production of ergosterol. Ergosterol eventually that leads to the production of what? Chitin that is responsible for the structural integrity of the fungus. Okay, so when you inhibit the enzyme, there is no production of ergosterol, there is no production of chitin, and the fungi can die. If you take large dose, fungi can die. If you take low dose, fungi can stop reproducing. That's the difference between fungistatic and fungicidal. All right. So number three, what's the important assessment? What important assessment should a nurse perform before administering ketoconazole? So one of the important assessments the nurse should give before administering ketoconazole is do what? Liver function test. I told you that ketoconazole are drugs known as enzyme inducers, and because they're enzyme inducers, they will make the liver produce more of the enzymes they are supposed to have. Okay, and therefore it can stress the liver. So before a patient can take this, you have to tell the patient to go for what? A liver function test. All right. Then you can also ask the patient if the patient take alcohol. All right. You can also ask the patient for the medications that they are currently using. All of these are necessary for before you administer ketoconazole. I give you all of this information. So what is the most serious, unique side effect of ketoconazole? Hepatotoxicity. All right. So hepatotoxicity is one of the major side effects that ketoconazole come with. All right. So it goes on to say that those of you that abuse it for whatever purpose you use ketoconazole, you are not supposed to use it for those purposes. All right. Then why is oral ketoconazole rarely used today? Because of the hepatotoxicity side effect that it complains, or that it gives. All right. So ketoconazole is rarely used because the side effect that it gives is usually almost worse than the disease that you want to treat. Imagine this man trying to treat um, a skin infection and eventually ends up having a liver disease. It's not going to be funny, because the man should be it's just itch and rash that the person has, and then you are therefore telling the person is a new liver. That doesn't make sense. So instead of that, you just do what? You just simply give any other class of medication to prevent that kind of problems. You understand? That's why it's really used. So what endocrine related side effect is unique to ketoconazole? I did not say this in class. Of course, I told you, sorry, I told you that the reason why we do case study is because sometimes case study helps us to see areas that were not mentioned in class, okay, because of how broad some of these drugs are. So what endocrine related side effect is unique to ketoconazole? Now, ketoconazole, because it's an enzyme inducer, it also makes the hormone malfunction. That is, it gives us um, excess hormones in some cases and affects other hormones, reduce hormones in some cases. Now, I also told you that some of the sex hormones that we have in the body are all cholesterols. All right. So most drugs that are used that inhibit or impact the cholesterol, ergosterol in fungi, we also invariably impact the cholesterols in the body. And some of the cholesterols I mentioned in class, testosterone, and some other human hormones that we have. So ketoconazole will be notorious, or sorry, will be rather known to reduce um, testosterone, that's libido, sexual urge. So patients who are on it will definitely not have enough or the same sexual urge as those that are on that are not on it. So ketoconazole use, apart from the fact that it does what? It induces the liver and cause hepatotoxicity, it can also lead to decreased libido in some patients. And it can also lead to what they call gynecomastia. All right, gynecomastia and decreased libido. Sorry. So as I'm teaching, as I'm talking, if you have any question, just simply type it in the comment section. All right. So what nursing instruction should be given regarding food and drugs? If you want to understand really the kind of drug to avoid in taking ketoconazole, or when you are taking ketoconazole, you just have to know the drugs that are metabolized in the liver. And funny enough, it is almost all drugs that are metabolized in the liver. All right. So when you're saying what nurse condition should be given regarding food and drug, you just say avoid drugs that water metabolize the liver. Example, please don't just write that statement like that. You can write something like avoid taking with warfarin, because I explained warfarin and protein binding in the class. Avoid taking with many other drugs that are also enzyme inducers, because then they cannot lead to hepatotoxicity in a faster rate. All right. Then you take ketoconazole with food. Supposed to be taken with food in order to do what? To reduce the GI side effects that usually come across, or that usually goes with it. Okay, avoid the use of alcohol. All those things are necessary nursing constitution that you use, because alcohol and ketoconazole have the same impacts in the liver. Alcohol induces the liver to produce a lot of enzymes. So also the same thing ketoconazole does. So when you are administering ketoconazole to any of your patients, you will ensure you avoid, tell them, if you want to live long, especially if you want your liver to be healthy, don't take alcohol as you are taking this drug, because they are going to cause liver damage fast. All right. So the next question: what signs of liver toxicity should the nurse monitor? So I think I want one or two persons to answer that question for me before we continue. What signs of liver toxicity should the nurse monitor? Now, I gave us signs of liver toxicity in the class. Who can please share with us what signs of liver toxicity should the nurse monitor? I'm waiting. DAX2. God bless you, Gloria Daffy. Edema. Did I mention edema? I did not mention edema. In class, I mentioned DAX2. All right. You can tell me any other one. I think I mentioned abdominal pain. Okay. Yellow coloration. Yellow coloration by Ojo Blessing. Jaundice. Thank you. Abdominal pain. Yellow coloration, like Ojo Blessing, has to do with jaundice. Okay. All right. So that's that for that. So let's quickly go to case study B. Now these are just the two case studies we are going to study today. Funny enough, Mr. Osaon is a 52-year-old man admitted to the medical ward with persistent fever, weight loss, night sweats, and shortness of breath. He is HIV positive. Thank you, promise. Is HIV positive and not yet stable on ART. ART is antiretroviral drug, antiretroviral therapy. Blood culture confirms a systemic fungal infection, cryptococcal meningitis. The physician prescribed Amphotericin B IV infusion once daily. Okay, so now I remember in class telling us that Amphotericin B is administered systemic, and then it is used to treat severe illnesses. And the way Amphotericin B works is that it's classified under polyenes, and it works by inhibiting ergosterol. All right, it allows the ergosterol to be produced, but it inhibits it from working. Okay, so let's say the questions that will come from that. So usually, what I will expect from you, class, is that when you see a case study, you should be able to have an idea what is likely, or what questions likely going to come out. Before you look at the question, you should be able to read the case study. Or sometimes you can read the questions first before you read the case study. It will help you. It will help you understand, because case studies are supposed to just be like a patient before you. When you see the patient, you will to know what exactly is the problem with this patient. So, what class of antifungal drug is Amphotericin B? That will usually pass for half mark or 1 mark. That's polyenes. Amphotericin B and polyenes. And I told you that there's also nystatin in this class of antifungal drug. What is the mechanism of action of Amphotericin B? Okay, I told us in the class that Amphotericin B acts by doing what? Preventing or binding to ergosterol. This leads to dysfunction in the production of chitin. That is, chitin is on the fungi is unable to produce chitin because ergosterol is being disrupted, and then the fungi cell wall now becomes compromised. Okay, there will not be holes, puncture holes that cause leakage to the fungi cell wall, and unable to do what? Unable to maintain the integrity of the cell wall. Okay, question 4. What is the baseline assessment should the nurse perform before starting Amphotericin B? Now, if you're in class, I told you that Amphotericin B, unlike azoles prevent the enzyme that produces ergosterol. Amphotericin B, on the other hand, binds to ergosterol, and ergosterol is actually an analog of what? Of cholesterol, of steroids. And there's a place in the kidney that's responsible for the production of steroids. So that is actually the place that is being affected in the case of Amphotericin B. Amphotericin B, therefore, have a penchant for causing kidney disease. Okay, so what you want to do in a patient before you administer Amphotericin B, you want to check their renal function test. You want to check their electrolyte balance, because that's all those has to do with the kidney excretion rate, and then you want to check their vital signs. So it therefore means that patients who are taking Amphotericin B want to take a lot of water, because that is the same route. The kidney is one that does filtration, ultrafiltration, reabsorption, and the rest. So you want to take a lot of water to reduce the side effects and the complications that come from administering Amphotericin B. All right. Hey, blood pressure says, sir, please slow down a bit. Wow, I'm sorry that I'm too fast. I didn't know that I'm too fast. All right. So That is question 4. Let's go to question 5. What is the most common serious? What is the most serious and common unique side effect of amphotericin B? Nephrotoxicity, which is kidney damage. I just mentioned it in a previous question. All right. Then, somebody said slow down. I don't know how to slow down. This is a live stream. How do I slow down? Do I talk slowly? Okay, I'll try to talk slowly. Okay, number 3. Somebody said number 3. Did I miss number 3? Okay, yes, I missed number 3. Number 3 says, why is amphotericin B used for this patient instead of oral azoles? I don't know in class if you remember me. If you remember when I said that when fungi are the cause of systemic infections, they are quite very deadly. You understand? So you do not want to use oral medication in that case. Okay, you're looking for an IV. And funny enough, this is what is formulated as an IV. Amphotericin B, okay, is used for life-threatening systemic infections. All right, so that's the answer to that. Thank you very much for that reminder. Okay, that's happiness. All right, I'm slow. I think I'm slow enough at this time, at this rate. What's the next question now? What infusion-related reaction should a nurse anticipate? I did not say this in class. I remember the nurse. I don't think I said it. When amphotericin B is administered via IV infusion, it is known to cause a reaction known as amphotericin B reaction. It is common because that's why they tell me that name. So what it causes it causes headache, muscle pain, fever, and chills. All right. So in order to reduce this amphotericin B reaction, what they usually do is that sometimes they will give antihistamine, and then sometimes they will give paracetamol. They will give beforehand, before they administer this amphotericin B. They will give the patient amphotericin B. They'll give the patient paracetamol IV or IM rather. Then they will give antihistamine, maybe that Piriton or fexofenadine and the rest. Okay, and then they will also administer the amphotericin B very slowly. All right, in order to reduce these side effects, this amphotericin B like infection. So number 7, what nursing intervention help reduce infusion reactions? Okay, I just said it already. So that is what exactly reduces it. Okay. All right. Number 8, why should electrolyte be monitored closely in patient that is receiving amphotericin B? Basically, the kidney is responsible for electrolyte balance. All right. So if the kidney is affected, there are going to be a lack of many other electrolytes and the things that the kidney does. So you monitor electrolyte because amphotericin B is known to affect the kidney, and it's known to also cause reduced potassium and reduced magnesium. Okay, it's part of its mechanism of action. It reduces potassium and reduces magnesium in the kidney. So you monitor the electrolytes, you monitor the kidney function test. Okay, you monitor electrolytes, monitor kidney function test, and you ensure the patient is well hydrated. All right. Then number 9, what signs indicate worsening kidney function that the nurse must report immediately? So if you want to know a patient that is having kidney disease, what are the signs will you know it as a nurse? Okay, one of the signs are signs that affect the kidney. For example, the patient's urine is very small, 2 or 3 drops, 5 drops. You understand? Then you start seeing red blood cells in the kidney, in the urine, start urinating red pigments. Okay, then edema. Edema is one of the signs of early kidney damage. Then you also see some other electrolytes will be imbalanced. within or outside, outside the range that's supposed to be. For example, the creatinine level begins to increase. Okay, so all those are the things or the ways to know. All those are the ways or the things to know. Thank you very much, Amatoria. Curious. All right. Then the last question here, I think number 10. What important patient education should a nurse provide? So, who can give me one important nursing consultation the nurse should give? One important nursing consultation the nurse should give to patients that are on Amphotericin B. What important nursing consideration or patient education should the nurse provide? Ensure proper hydration. Thank you very much, Chuku. Another person, please. Ensure proper hydration. As proper intake of water. Somebody has said it. Somebody has said it. Is that the only thing you know? Give IV fluid. Why are you giving IV fluid? What is the problem of giving? What is the reason for giving IV fluid? All right. It seems everybody is just talking about the water part. Okay, I think I mentioned a lot of things that the patient can give. All right. You can explain to the patient the reason for the chills and the fever. Okay. Then you can tell the patient to ensure they carry out routine kidney function tests. All right. And the patient should report anytime they urinate, the urine output reduces. When you tell the patient, thank you very much, happiness, avoid drugs that are metabolized, in the kidney. Now, this makes sense. Now, of course, you may not be able to avoid them totally or completely. What you can just do is that you can communicate to the physician whenever you have any other illness. Oh, I'm taking this drug. You understand? And that can also help. All right. Then I think polyuria, no, they cannot experience polyuria, please. All right. So that's that for that class. Thank you very much for your time. These are just two case studies. Please, I will beg you, make sure you go over this video all over and again. Most of your most of your exam or theory questions will come up from most of these things that I share. Read them, watch them, comment. If you have any question, please, after this, okay, Josephine is saying check for magnesium, potassium. Yes, these are very necessary. Thank you very much, Josephine. After this live stream ends, please don't comment on the video. I will not be able to see the comments. You can comment on them and let me know that you commented on them. I can go back and check, or you can simply ask the question in class. Okay, or you can meet me and ask me anytime, or you can chat me on WhatsApp and ask me then. All right. So what's going to happen now is I'm going to drop a link for us to take our test. Now, I understand that a lot of persons will not be able to access this link, and that can cause some level of difficulty. However, I'm going to state something clearly here. When I drop this link, I'm going to give about 10 minutes to answer the questions. Okay, 10 minutes, answer the questions and submit. Okay, if you are having difficulty accessing the questions are long, so please ensure you submit them on time. If you have any difficulty answer the question, what you just have to do is tell your class rep to share my number, take a screenshot of the issue you're having, Tell your class rep to share my number, send me the screenshots, and I will reschedule a new test for you. That is the best I can do for you. But if not, ensure you send the ensure you submit. Okay. Then I also understand that some persons, for one reason or the other, are unable to join this live stream. That is the reason why I will send this link to your class rep DM right now. He will drop it on the class page. So as soon as you get in the class page, those that are not online here should be able to have the test and apply and write it. Okay. Then when you are writing your mat number, the way I know people who did not attend my class. Okay. This is how to answer the questions. I explain the procedure. Okay, I'll explain. So when you're writing your mat number, please write your mat number and your full name. The way I will know people that did not attend my class that eventually submit, because I know people can just send it and fill anything and submit, are those that did not write your number in full. Your mat number, write it in full. If you are ND/NURO/ whatever you write. If you're RON/NURO, don't put 02 or 01 or 23 there. I will know you did not attend this class. Your mat number in full and your name and surname in full. Capital letter all through. Okay, capital letter your surname. If your surname is Osahon, like me, or Ezekiel, like me, write it Ezekiel in full and your surname in full, and then your mat number beside it. Because the column for mat number and surname and name are the same column. So type your full name and mat number after it. All right, space your mat number after it. So I think that is that for that. Then I have to state this too. Please do not try to get everything. If you get everything, it's not a problem if you get anything anyway, you're fine. However, if you do not know any of the questions, any of the answers there, just leave it. What I'm trying to pay attention to are those who attend the class, those who listen. Of course, there are some questions you have to get, because all the things that is not questions are gotten from this class, this case study, these two case studies I did. So for post basic students, please just put your mat number info, please. Post basic students, there's no special rule. God bless you. Igbinosa, sorry, may bless you. Not on the comment section, please. Not on the comment section and get that's not what I said. You drop it in the form when I drop the link. There's a space for the link. Okay, if you don't have my number, put your phone in place. The post-basic student that don't have my number, please put your full name. I would understand that. All right. Put your full name, put your phone number, put your email address. All right. Thank you very much, Fola, for that information. So I think that's that for that. God bless you. I'll drop the link now. Please click on the link in the comment section and go and answer. So I will end this link. I'll end this link exactly 6:40 rather. In 10 minutes time, I'll end the link. So thank you and I wish you success.